Okay, so is it Lyme disease or Hashimoto's? I'm going to do this, even though a lot of you are going to be like saying bad things about me afterwards. So there is there's a culture out there, and that's how I prefer to refer to it, and I call it a Lyme culture. And the Lyme culture is built around the infection of a human being by Lyme disease, which indeed occurs. Okay, and when we were trying to figure out chronic fatigue, and we were trying to figure out chronic pain and fibromyalgia, there was two factions, and one faction was the alternative medical world, and the other faction was the alternative non-medical world. And the alternative medical world it's designed to attack the symptoms, it's designed to attack the bug, it's designed to kill the bug, it's designed to find the one thing that they think might be causing something. So Lyme disease fell into that category, heavy metals falls into that category. There's a number of things that fall into that category that in kind of what I call the dark ages of like when we were trying to figure this out, people would get treated for Lyme, they'd feel much better. People would get the heavy metals taken out, they would feel much better. But I had a lot of patients who came in from that, felt much worse, or it didn't help them at all, or they were on their third trial of antibiotics for 6 months, which is there's no justification for that anywhere. But that was the Lyme issue, and then there was a whole language of killing the Lyme, and then there's the dark field microscopy, and certainly the Lyme hides, as does Epstein-Barr virus, as does other viruses. Okay, viruses hide. That's what they do. But I mean, remember being dragged in and look at here's the virus, and you can see how it hides, and I'm like, that's common physiology for a virus. So I was never against it. Now I'm in Reno, Nevada. Chris, I don't know if you're still here, or I'm going to talk about you, but I'm not going to say your last name. But he was here. He was an alternative medical doctor, alternative dentist. I went to him. My wife went to him. And we had knockdown, drag-out fights over Lyme because he was the president of the National Lyme Association. And in his world, everything was Lyme. Everything that we were looking for the answer for was Lyme. Okay. So here's what I've seen, and I know many of my colleagues will agree with this because this is what we do. So there are 40-some triggers, 42 triggers for autoimmune thyroid disease, Hashimoto's. Okay, one of them is listed as the Lyme, as Lyme. I have a little chart here on all of the 42, and the one that is listed is the Borrelia burgdorferi down here. These are all of the triggers for autoimmune thyroid disease. It's listed here as one of them. Here's what was found at the University of UC Davis, I want to say like 2015 or something like that, was that the Lyme bacteria comes in, it's for real. If you don't get rid of it right away, it is going to create chronic problems in the future. Not unlike Epstein-Barr virus, not unlike herpes viruses, not unlike shingles, not unlike those things. It's in our world, it's in that category. Okay, it's a bacterial infection, and so the medical model is let's try for 6 months or 6 years or however long they'll give you antibiotics to try to kill it and freeze it and do all this other type of stuff. But in the end, if you get to it with the antibiotics in the first I'll stretch it out and say 12 weeks, but usually it's going to be like 6, and you kill it, life is good. But if you don't, it's going to have this long-term ability to express itself when you're compromised, when you get stressed or things of that nature. What they found at UC Davis was that what actually happens is the Lyme gets into your system, and if you haven't gotten rid of it, it actually attacks this enzyme in your joints, which is a cardinal sign of Lyme disease. And it's called an MMP10 enzyme. And it's an enzyme that cleans out the dead cartilage in your joints. Okay. But here's the situation. That is now an autoimmune problem. Okay. That is now because it's attacking self tissue. So that enzyme is you. It's you. So when you have something that attacks an enzyme, that's an autoimmune problem. Now here's the thing. Most people don't get one autoimmune problem. So let's say that person has Hashimoto's, which will cause hypothyroidism, which will cause fatigue and hair falling out, and it'll cause your gut to be bad, and it'll cause your cerebellum to be up. And let's say you have antibodies against your cerebellum. Now let's say you have Hashimoto's, you have celiac, and you have autoimmune gastritis, and you have an attack against your cerebellum. That is something that happens commonly because all of those elements, all of those tissues look the same to the immune system. So if one gets attacked, all of them can't get attacked. Back to Lyme. You attack the joint. Many of those people are going to already have autoimmune thyroid disease. Maybe they know it, maybe they don't. They're already going to have celiac. Maybe they know it, maybe they don't. They're already going to have autoimmune gastritis. Maybe they do, maybe they don't. Maybe they have all of them. The Lyme now sets off immune responses that's attacking the joint, but now it starts attacking everything else. That's what I see. And that's what our world is about in the functional medicine, functional neurology, autoimmune world. So when people come to me, if they have a positive Lyme issue and I'm looking at blood panels, and that's a whole controversial thing in and of itself. Honestly, God, half the doctors take these Lyme disease, these markers, don't know how to read them. It's stunning to me, but a lot of them come in and they're shoving it in my face and say, well, this says you had it a long time ago, but it says it's not bothering you now if you know how to read those. So first you'd have to know how to read the findings. But if you look at your labs and that person's not in some sort of a chronic viral or chronic bacterial infection, chronic bacterial infection, or if that person's not an acute bacterial infection, you can tell that by looking at your CBC, white blood cells, and all that type of stuff. It's kind of like herpes. It's kind of like shingles. You have shingles. It's a viral infection. It's not a bacterial infection, but it's still the same thing. And so you get stressed. Your immune response goes down. That the virus is able to express itself, and you get shingles. Most of you are familiar with you get shingles when you get stressed. Okay, there's a lot of other things than just mental stress that does it. So this is a similar thing. So if that person has signs that it is active, I'm certainly going to attack it. I certainly am going to use. And there are lots. There's one product out there called biocidin, and I'm not getting paid to say this or anything, but I use it. It was designed to neutralize Lyme disease, and it also happens to work on a lot of other things. It's this broad spectrum antiviral, antibiotic. It's an amazing product. You guys from Biocidin, you should pay me for saying this, because it really is. And so, if there is evidence that the Lyme is actively creating the problems along with many of the other things that are on this sheet, then I'm going to attack the Lyme early. If I'm done with that patient, we've completed our protocol successfully, and now that person's looking for something to take long-term to try to stop them from getting those attacks, I will have that person take a natural antibiotic at a low level to try to keep that under control so that it doesn't jump up the second you run into some sort of a stress. that's my take on it. Since that study came out, and I want to say 2015, it was around there, maybe even a little earlier, but I think it was right around there. And that study came out on how that attacks. Then it became obvious that, okay, it's attacking, it's creating an immune response. The person has other immune diseases. Everything blows up. And thus, my buddy Chris, my dentist, and my buddy Chris is like, it's all Lyme disease. Yeah, well, you're getting the symptoms from the Lyme, you're getting the symptoms from the thyroid, from the celiac, from the cerebellum, and all that type of stuff. And you have all of these symptoms, and your doctor is like, their eyes are rolling like, okay, this person needs to see a psychologist because nobody can have all this stuff. Oh, it's Lyme. Fair enough. There was a time when that was fair enough to say. But I think with our understandings today, I think what I'm sharing with you, which is my experience, and when I say my experience, I execute treatment protocols based on what I'm telling you, and our outcomes would suggest that what I'm telling you is more likely correct.